My name is Tara, and today I'm going to do a physical assessment. I would enter my patient's room and I would wash my hands. I would identify my patient's name, their date of birth. I'm going to also ask them what today's date is, just to make sure they are alert and oriented. I would also let them know I'm going to do a physical assessment on them today. I would assess them if they have any pain. As of right now, I'd have them rated on a scale of 1 to 10, 1 being the least pain, 10 being the most. Before we had entered the room, I had also assessed the weight and the height on my patient. I'm going to take their temperature, also assess the blood pressure. I'm going to check the radial pulse for 30 seconds. I'm going to check respirations for 30 seconds, and I'm going to times both of those by 2. Next, I want to take a look at the facial symmetry. I'm going to have my patient smile. Make sure there's no drooping going on at all on their face. I'm going to look at their teeth and make sure that they're intact. I'm going to also check the gums, make sure they're pink. Check their lips as well if they're dry or cracked at all. I want to take a look at their mucous membranes. Make sure there's no drainage, any discoloration at all on those as well. Next, I'm going to check the 6 cardinal fields of gaze. I'm going to just go out, up, down, up, and down. Make sure that they are equally, or they're both equal with following my light. I'm going to also check the pupils on both eyes and make sure those are equally round and resistant to the light. Next, I want to take a look at, or I'm going to actually auscultate my patient's heart sounds. I'm going to start out with the aortic, the pulmonic, tricuspid, and the mitral. I'm going to listen for any bubbling, any signs that could indicate there's some troubles with the heart sounds. Next, I want to take an auscultation of the anterior lung sounds. And I'm going to listen to all 5 areas. So I'm going to start with 1. And each time I'm going to have my patient breathe for me. 2, 3, 4, and 5. And I would note if there's any crackles, rhonchi, any wheezing, and any sounds that there could be like some friction rub going on. Next, I'm going to assess the musculoskeletal on my patient. I'm going to check the hand grasp. I want to make sure that those are equal. After I'm done doing that, I'm going to check the capillary refill as well. If it's less than 3 seconds, that would be negative Homenside. I want to auscultate the the ball sounds. I'm going to listen to all 4 quadrants. And next, I want to palpitate the abdominal area. I'm feeling for any distension. Make sure that there's no pain at all for my patient. I want to ask them when the last time that they had a bowel movement. I also am going to assess the last time that they voided, or not the last time, but if they have any troubles with voiding, any burning during that. Next, I'm going to work my way down to the dorsal flexion. And as I push up on my patient, on their foot, I want to have them push down. Same thing goes when I push down, I want them to push up. I want to assess the pedal pulse as well, and that is all normal findings. Next, I'm going to auscultate the posterior lung sounds. And I just kind of assist my patient with sitting up. And I want to assess all 9 areas. And I'm going to have them breathe each time. And at this time, I would also listen for any crackling, wheezing, rhonchi, or any friction rub. I have concluded my physical assessment. I will ask my patient if they have any concerns at all any questions that I could possibly answer for them. And then if they need some patient teaching information, if they have any health histories with any medical problems that we could possibly help them out with. I would make sure my patient was comfortable. I would lower the bed, and I would also make sure the railing was up, and I would go document my findings.